Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. I'm in studio. It's chilly outside, but nevertheless, I'm here to give you the information that you deserve, bring you all the data that you need to have to fix yourself without drugs, without surgery. It's an opportunity, as you say. You can ask whatever you need to ask, and perhaps I can put you in a direction because whatever you've been trying hasn't worked. 888-630-9625. 888-630-WMAL. Love to talk to you on any subjects. I've got several. We're going to kind of touch the trail, if you will, on pain and mercury and things of that nature, and why my mantra is sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, all that nonsense that I tell you to stay away from. Why I tell you to stay away from it. I mean, there's articles out there telling you that you can drink all the coffee that you want because it opens your brain and makes you more active. It has tremendous antioxidants and so forth. Well, I'm going to debunk that, particularly for those of you who are in pain today. Everybody says, well, why can't I have a cup of coffee? Well, I'm going to tell you about that, and I'm going to tell you why you can't have a cup of coffee, or you shouldn't have a cup of coffee, and why it's so addictive, even on the point of being equally addictive as heroin. That's right. You heard it here first. Coffee can be and goes after the same receptor sites as many of the illegal drugs, and this one just happens to be legal. But I'm going to tell you why, and I'm going to tell you what happens, and we're going to talk about that. We're going to talk about why your pain goes to the spine and it won't go away if you happen to be a little overweight, and there's some very interesting articles on that. 888-630-9625. That's 888-630-WMAL. Love to talk to you. I want to encourage you. It's the holidays. Christmas is coming up, and Hanukkah just ended. I think it was last night. And we have the New Year coming. And what better gift could you give to anybody than my book? That's right, Ageless Health. Health is a do-it-yourself program. It lays it out for you. It tells you. It's a treatise. It's a manual on how to get your act together, how to step up and make your life better than it's been. See, where you are right now at this moment in time is because of the decisions that you've made relative to your health. The foods that you eat, the exercise that you may or may not get, the emotional state that you don't know how to break. All of those things have a product. It's called your health. And if you'd like to really understand how that works, Ageless Health. Health is a do-it-yourself program. You can call our office at 703-698-7117. You can go to rosellecare.com, ROSELLECARE.com, or you can go to Amazon, and it's all there. So check it out. Buy a gift for yourself. And you know what? The people that you love. It's a wonderful opportunity. 888-630-9625. I want to talk about spinal epidural lipomatosis. That's a big deal word, right? Well, what it really means is that you got fat inside the spinal canal, you know, where the spinal cord comes down. So we need to talk about that a little bit because there are a lot of surgeons out there that are finally realizing that it is not necessarily about disc spaces that are getting crushed and, you know, degenerative changes and so forth, although we're going to talk and weave our way through that today. But spinal epidural lipomatosis, SEL as it's called, is excessive fat deposition inside the spinal canals, responsible for compression of the nerve roots or the spinal cord itself. And guess what? It causes symptoms, and that symptom can be pain, it can be loss of function. It's commonly seen in patients with too much fat in their body, and this fat begins to infiltrate into the system. and also people that are receiving long-term steroid therapy, because guess what one of the side effects of steroid therapy is? Fat accumulation in the body. So when you see something called idiopathic SEL or spinal epidural lipomatosis. Boy, I like what that word. It just kind of flows off my tongue. Not really, but anyway, it's a rare condition, but has also been extremely well documented. The problem is it's becoming more evident because we're getting to be fatter as a society. So when we pop up these MRI images when somebody comes in our office with back pain, they begin to show a lot of evidence of this stuff getting in the system. There was a great article that was written by a doctor by the name of William Morgan, and he is a guy that, in conjunction with the School of Medicine, Uniformed Services University of Health Sciences, and the New York College of Chiropractic, they did a study, and this is where this came out. And it's just not a limited study. It was very, very broad-based. So what you need to look at is simply this. Are you too heavy? Or not only, if you're not too heavy, what is your body fat protein muscle ratio? So are you way fatter than you should be inside? So if that happens, guess what? Fat can get into the spinal cord. So, it's one of those things that Dr. Tom Roselle just says, heads up. If you're too fat, do something about it. If you think that your body proportions are off, then you need to do something about that as well. But the evidence is mounting, and unfortunately, as a society, it's growing, and it's not very good, and it's not very kind to you. 888-630-9625. Let's go to the phones. Interesting phone call coming up. Barbara from Manassas. How can I help you? Thank you for calling.
I'd like to know if you have any advice to give for somebody with macular degeneration.
How advanced is it? How far down the pike is it? How bad? Have you lost vision? Is it central? Is it a wet or dry macula?
In one eye, it's beginning.
Is it wet or dry? Meaning,
I'm asking for someone else, so I'm not quite so sure how to answer your question.
Okay, so depending...
It's for a younger person. It's not for...
It doesn't make whether it's old or young doesn't make any difference. It depends on whether it's a wet macular degeneration or whether it's a dry macular degeneration. The wet means that there's bleeding inside and it has different characteristics. However, what the patient needs to know is that there's many things that can be afforded, can be done to slow it down. Depends on the stage of it, but mostly the antioxidants are critical in this situation, and even including an herb called eyebright. And if those things are used along with acupuncture and low-energy light laser, I've seen some significant changes in the progression of macular degeneration. We've had patients that are patients of ours for other reasons who have come in and said, oh, by the way, I have macular degeneration, and we put them on many different types of antioxidants depending on their condition, and then we also prescribe acupuncture and low-energy light laser in our practice, and we've seen some very nice resolutions of these conditions. Barbara, I wish I could be more specific, but there's more data that I need to know from you. And whether
I'm sorry, I don't know if it's wet or dry.
It's all right. I'll tell you what you do. You have them write me at rosellecare.com, ROSELLECARE.com, and I'll be more than happy to go back and forth with them. Barbara, thank you for calling. I appreciate it. 888-630-9625. That's one of those things you need a little bit more data, but the general sense is with any kind of macular problem, if you know the intimacies of it, like was there trauma, whether, what kind of exposures, are there allergens, are there things that have been constantly irritating the macula of the eye, all of those things come into focus, but again, I've seen significant resolution of many of these things. Let's talk about your cup of joe, your cup of coffee, and anything that has caffeine. What do I mean by that? Well, tea. Remember I said sugar sodas, coffee, teas, black teas, fast foods, fried foods, alcohol, gluten. By the way, we're going to put, unfortunately, chocolate into this mess because chocolate has a lot of caffeine. Interesting article by a guy by the name of Lloyd Frank Jarrell, and he was putting out some data that came about of a recent article from Johns Hopkins Medicine on March 19th, 2012, so this last year. And what it did, it focused on a long debate over the number of studies that very much illustrate and focus on caffeine's role in the physiology and pathology of addiction. So what does that mean? Well, first of all, caffeine is a very addictive disorder. This article that came out in March was titled Caffeine Withdrawal Recognized as a Disorder, and it recognized that there's a problem here, right? So in the Johns Hopkins study, they reviewed over 170 years of research relative to caffeine withdrawal. And what they came up with is that people can be addicted to as little as 1 cup of coffee a day, producing some very, very significant results and not good ones. So as you go through and you look at this thing, there's a lot of heads-up situations. So what do we know from, through recent research? Well, one, caffeine shares the same receptors that draw dopamine, or the pleasure, feel-good, stuff in your body, the chemistry, and it's housed in the midbrain. And these receptor sites also are the ones that will attract things like nicotine and marijuana, cannabis, cocaine, heroin, opiates, and so forth. And from this review from Johns Hopkins that was being done, and also the guy that was doing the study, this guy by the name of Roland Griffiths, a PhD type of researcher, they really got into why this all comes about. And here's the deal: it's like, when you look at our general population, 80 to 90% of adults consume at least 1 to 2 mugs of coffee, or 3 to 5 bottles of soda every day. I mean, that's a huge amount of stuff. And you're sitting back there smugly saying, well, I only have a glass of soda, or only have a cup of coffee. Well, don't go away, guys, because I'm going to give you some data that's going to turn the tail on that piece of information as well. So, but this is, what we look at from not only a conservative point of view, but this is biochemistry at its best relative to understanding how things work in the body. If you know me, for years I've been saying, get off of coffee because it causes spinal degeneration, it causes breakdown in the system, and it's many times unrecoverable once it gets to the place of degenerative change. I'll give you an example. A lot of you saw the Ageless Health special that featured 6 patients and miraculous turnarounds and so forth. And one of them was a firefighter. Now, this guy came into me many years ago, and he was in pain. He'd been everywhere. He'd been medical physicians. He had all kinds of drugs. And he was going to have to give up his job. He was going to have to give up his job as a Fairfax County firefighter. So he came in, and I said, listen, you know what your problem is? You're hooked on coffee. You're hooked on caffeine. He says, can't be. This guy was drinking a lot of coffee, right? I said, and it took me a while, and I had to prove it to him, and I showed him, and, with no muscle function testing, and we treated him. And I said, nothing that I do for you is going to make a difference unless you give up that coffee because it's destroying your system, and this is why. So you saw the presentation. He came in, we treated him, and guess what? His problem turned around, and he retired 2 years ago, or 2 years ago, after 33 years in the fire department. Why? Because he gave the coffee up, and we were able to do things structurally that actually allowed him to be stable and to be able to heal in his body to do what it needs to do. The problem with any kind of caffeine, it's a major game changer, and if you understand it, you can begin to resolve so many other things that the body at this point has been unable to turn around. And I'm going to talk to you about that. I want you to really understand. I just don't want you to listen to Tom Roselle say, hey, listen, get off the coffee because it's no good for you. I want you to get off the coffee because you understand what it's doing and how it's destroying the body. But to start with, what I want you to get is that caffeine of any kind, whether it comes from chocolate or black tea or it comes from the coffee that we're drinking, competes with something called adenosine. And adenosine is a neurotransmitter, and it's a messenger in the brain. And it has a powerful effect on both smooth muscle and also on skeletal muscle. So when caffeine gets in there, it begins to mess around with these receptor sites, but it also causes calcium channels within the muscles to open up to a much larger degree and for longer periods of time than adenosine does, causing very severe muscle contraction. We're going to talk a little bit more about that, but right now we've got to take a break. I'll be right back. You're listening to Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm in studio. 888-630-9625. 888-630-WMAL. Love to talk to you. We're talking about some very interesting things. I'm kind of putting the damper on your consumption of caffeine and coffee and, all that nonsense. But, step up to the plate. Take it like a big person and, do what you got to do to make yourself feel better. Seriously, we're going to get into the why behind the caffeine problem in more depth just in a minute. But before we do that, I want to go to the phones. Larry, thank you for calling. How can I help you, sir?
Oh, hi, doctor. My daughter has a couple things. She has Ehlers-Danlos syndrome and POTS.
Yep.
And she's in a lot of pain all the time. She might also have tethered cord. Anyway, she just got her wisdom teeth out this weekend, and she's been on Dilaudid, and she says it doesn't help the teeth, but it helps all the other pain, and she's asking about going on that, like on a regular basis. Normal drugs really never help her.
Well, let's, for our audience first, let's talk about what Ehlers-Danlos syndrome is, or EDS. Basically, it's a collagen disorder. It's often thought to be an inherited connective tissue disorder. It's caused by a deficit in the promotion or the synthesis of collagen, and we won't get into it. But what you see with this type of patient, if it's in a significant presentation, is that you're going to see hypermobility of the joint spaces, but you're also going to see almost like a plastic skin where you can pull on it and so forth. But the problem is that it affects all the major body organ systems and also joint spaces and the like. My experience with this is significant in that we've seen many, many patients over 36 years that have presented with that type of thing. The joint spaces, as you know, are unstable, and there's degenerative osteoarthritis, and that comes on much more quickly. There's a fatigue pattern that's significant, even to the point that some people think that's a chronic fatigue. There's a greater capacity to tear joint spaces, and we could go on and on and on. But the point of it is that it's a problem that in the medical community they consider to be unresolvable, and they treat it in many different ways. And the one thing that they keep the closest look on is the cardiovascular system. Now, having said that, what kind of medications is she on right now?
Not much. She has digestive problems. She takes Miralax and Docalax, but there's really nothing she takes for the pain. She takes some, multivitamins, vitamin D, things like that.
Okay. How old is she?
15, almost 16.
All right.
She was also doing physical therapy. That didn't help too much, though.
It usually doesn't. When you go after this, you have to go after organ systems that have to do with collagen and also autoimmune and norepinephrine production. Or norepinephrine, epinephrine. So you're going to go after the adrenal system. You've got to support that. You've got to go after the immune system. You have to make sure there's nothing in the body digestively that is causing inflammatory pathway problems. I can go through my mantra again: the sugar, sodas, coffee, teas, fast food, fried foods, alcohol. But more importantly, stabilization has to be with large levels of mineralization supporting the adrenal system, and making sure that the mitochondria, which are the power packs of the muscles and tissues and so forth, are adequately supported with many different things. Each case, by the way, even though there's a broad brush that seems to be applied to these patients, are very, very different. Some of them are going to present with the POTS syndrome, which has the adrenal linkage. Some of them are going to show significant postural orthostatic hypotension, where if they move too quickly, they're going to get very, very dizzy, almost a vertigo type of problem. But not all of them. They can vary in degree of severity depending on right. So what you do with this is you evaluate the patient, the individual, and from a functional medicine point of view, we're going to take a look at mineralization. We're going to take a look at adrenal stress patterns. We're going to take a look at how the body neurochemically begins to adapt. And there are things that can make it much, much more stable, and to the point where she will not have many of the symptoms that she's suffering with on a day-to-day basis will go away, and they'll be less problematic, and they'll show up only occasionally. She has to be evaluated again. So what would I tell you to do in the initial phases? First, if she's eating, and again, I'm not finger pointing. If she's eating any kind of junk at all, get it out of her diet. She needs to eat many times during the day, like a patient who has a hypoglycemic, hypoadrenic pattern, a lot of proteins, increasing the mineralization in the body, upping the antioxidants, things that will strengthen collagen, but she really needs to have a functional medicine evaluation outside the normal medical perspective. More than happy to take a look at her, more than happy to go back and forth with you specifically on email. But I think it's something that we might be able to help in support, or people who do the kind of work that we do would be able to help support you as well. Give me a call. I'd love to talk to you, but let me leave you with this. In my opinion, in my experience over the years, there's much that can be done to help support your daughter and to stop the potential degeneration that will come about over a period of many years. Again, we've seen, unfortunately, too many of these patients over a period of 36 years. And, again, from the medical point of view, it is what it is. It progresses, and there's not a whole lot they can do. Larry, thank you. I really appreciate it, and I feel for you. But, again, I want to give you a little hope because there's a whole lot more that can be done. Please give me a call. We've got a lot more coming up. We're going to get back in talking about the caffeine addiction problem in your brain and why it causes pain. And if you don't get off of it, you're in big trouble. But don't go away. We have to break for the news. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I am in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject. I'm talking about things that you don't want to hear about, called your caffeine addiction. And we're going to get into that a little bit more in depth. However, I want to remind you, there's a great website that we set up for you. It's called drtomroselle.com, drtomroselle.com. And if you check it out, there's all kinds of things are waiting for your education. We have videos, on-demand videos, and you can rent them for the day. You can rent them for several days, and they're not expensive. We did it in a way so you can go on there and you can learn. It's a great piece of information, and I'm really proud of it. I'm really pleased that we're going to add more and more things to that website, but go in there. And then, obviously, you can click on Roselle Care. That will take us directly, and we have a Roselle web store. And if you go on the web store, you're going to see all kinds of fun and interesting things, including my book. But you're going to see a shirt with my mantra, by the way: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, with a big circle with a slash mark through it. There's something called back vitalizers from Body Ryzm, RYZM, and these are pillows and things that you can put in your chairs, in your car, and so forth that will make you way, way, way more comfortable. So you can pick up that. You can pick up my book. You can do all kinds of great things. By the way, there's a DVD in there, and take a tour around. There's also some best of, live performances here at WMAL. So we're adding more and more to it. You'll see all kinds of things as time goes on. But take a tour. Let me know what you think. And, go into Amazon if you want to buy the book that way, or you can go into Ageless Health. One way or the other, it's all there for you. We're here at 888-630-9625. Let's talk about caffeine and your addiction. And we said that most of you are addicted over the top to this kind of craziness. And, 80 to 90% of the population drinks way too much coffee, and either that or 2 to 3 sodas a day. And it's causing you some major, major problems. So we're getting down to the nitty-gritty with this. We said, caffeine competes with something called adenosine. And it's a brain neurotransmitter. And it's a messenger that allows the body to work at optimal states. Well, has a tremendously powerful effect on smooth muscle and skeletal muscle. So caffeine signals these calcium channels in the body. You've heard, calcium channel blockers and so forth, to open up. And they stay open for a long period of time. Adenosine does the same thing, but it does it far greater than adenosine. Now, the result is that you have a much greater, much more powerful muscle contraction. And sometimes that's good, but a lot of times that's bad. But the problem is significantly less efficient muscle relaxation after the contraction. So you got a problem. If your body's muscles are constantly in a state of tension, then you're going to have damage to the fascia. You're going to have damage to the tendons. You're going to have damage to the joint spaces and the disc spaces and so forth. And biomechanically, you're in trouble. So here's what happens. Again, this includes even the smooth muscle and the skeletal muscles, the muscles that support your structural system, make you stand upright. And a result of these chronic contractures and metabolic congestion and tissue dehydration and inflammation and so forth, it also affects changes in the organ systems as well. So caffeine, my dear friends, is not your friend. It actually is something that's going to cause you a problem. But there's a double-edged sword metabolic scenario. See, muscle contraction to relaxation phases are required in everything that happens. You have to have contraction expansion. And some people are using coffee to go out and do better in sports. But if they don't have a greater relaxation phase to pair up with this contraction, we're in trouble. So caffeine does induce stronger and greater contraction periods, but while simultaneously it impairs the relaxation and recovery. So if you're drinking coffee, you can't relax. Your muscles won't let go no matter what. And then it also produces lower temperatures in the body, and that also allows for inadequate relaxation phases within the body, but it impairs metabolic clearing. You can't get rid of the waste because of that lower temperature. So all this waste builds up, and you end up with all kinds of tissue dysfunction. You have lymph that gets congested, can't move through. You have poor liver and kidney function, and your bowels can't clear and so forth. You get hooked on coffee. Do you never notice that you need a cup of coffee now to go to the bathroom? It's not okay. Let's talk to Grace. Grace, thank you for calling. Hi, Grace.
Hello.
Hi, how can I help you?
Well, I wanted to say that I've seen some studies saying that black tea is good for your heart, provided you don't put milk into it. They've done some studies in Holland and various other places. And also now they think, I don't drink coffee, but I'm constantly reading, even in medical journals, that coffee keeps one from getting diabetes. Mm-hmm. So I don't want to take too much.
No.
I'll hang up and listen to you.
No, I'm glad that you told me, because I'm going to tell you what that's all about as well. Understand the majority of these studies have been coming out of Europe, where people relax a whole lot more than we do, so they're not in constant state of fight-flight, and any kind of caffeine is going to put you into a fight-flight situation. Well, I'm sitting here having a conversation at the break with Luke, and we're talking about, Asians drinking black teas and coffees. And I said, yeah, they drink oolong teas and they drink green teas, but they're very mild. They're very light. They don't have the impact that so many of us like to sit there and brew it till it looks black. Green teas look so dark, and it's not supposed to be that way. It's supposed to be very gentle, very light. And you have it occasionally. Now, are the polyphenols in these substances, in black teas and coffees, significant that they have a benefit to them as well? Yes, they do. The problem is that we don't know how to do things in limited fashions. We drink tons of sodas, we drink a ton of coffee, we eat chocolate until the world looks level. We don't know what an occasional cup of coffee is. I'm Sicilian, right? I grew up with caffeine in the house. I could smell the espresso every morning, and when I'm at a good place, a couple, 3, 4 times a year, we're talking truth here. I'm going to have an espresso, particularly if it's good. But I don't do it weekly or daily or anything like that. It's like, okay, I'll pay for it tomorrow, and it's okay. And then I take care of it. But how many of you are doing that? I'm telling you that the problem, and we're going to get into it a little bit more, is significant. As a consumer, of coffee and black and green teas and soft drinks and chocolates and foods that are spiked with caffeine. Start reading your labels, by the way. Patients will experience poor relaxation phases, and we're already in a society that none of you know how to relax. You don't know how to let anything go. You don't know how to, the word, you need to chill. You don't know how to chill. Not one of you out there. Give me a break. You can't chill. So caffeine increased muscle tone over a long period of time results in general muscle fatigue and ache and stiffness and pain in the joint spaces and pain and spasm and, the accelerated degenerative processes. And, by the way, aging of connective tissue. Your skin and your muscles and your tendons end up suffering. That saggy, baggy skin that you get sometime? Keep drinking the caffeine. It's going to get really good for you. It'll get progressively worse. The you're going to end up with heart palpitations, your blood pressure is going to go up, your immune function is going to get suppressed. Sorry, it just happens to be the data. Don't trust me. Look it up, because I'm telling you, this is what I've been telling my patients for years. Anything in moderation is not a problem, but you have to learn how to do things in moderation. Most of you are addicted. You've got to have that cup of whatever. You've got to have that chocolate. You have to have whatever. If you're not going to do anything else, drink a ton of water and start pushing in all kinds of magnesium in your body so you can relax. Because if you don't increase that relaxation phase within the system, you're going to suffer the consequences of all these things, and you wonder why things don't go away. Your moods. And, when you take caffeine out of your body, if it's an okay substance, did you ever think why you go through the headache and the fatigue and I don't feel good? And, you're stimulating all these things. When you have coffee or sodas or chocolate and you're eating, you release adrenaline and cortisol. These are powerful agents of stress, fear, anxiety, inflammation, and it also will cause, by the way, poor wound healing. You're not going to heal as quickly. And as doctors can, begin to recognize these things, there's somebody else going to be beating on you besides me, but we end up with cognitive problems. And we're going to talk about the brain, because many of you think that if you drink coffee, your brain's going to kick in. Well, the data actually shows that if you start drinking coffee on a regular basis, your short-term memory conversion into long-term memory sucks. It goes out the window. You can't do it. You can learn for the moment because you think that you have a better thing, but that conversion loop is not there. It begins to break down. The data is there. Just, people want to kind of picture things the way they want to picture it. Fifth Avenue marketing is a wonderful, wonderful thing. But you have to understand that there are problems that may not have anything to do with age-related cognitive dysfunction. It may not have anything to do with the onset of Alzheimer's. It may simply be the fact that you're getting way too much caffeine in your system from all kinds of sources. Yeah, I'm the Grinch that stole Christmas, but you know what? I'm here to give you the data as it really is. Bob, how can I help you? Got a pain in your foot, huh?
I've got a pain in my left foot. And I went to a podiatrist, and he said surgery was the only answer. Is there anything I can do besides surgery?
What have you done besides going to the podiatrist? Anything yet?
What he did was treat an infection that I had on the lower left side of my left foot, and that helped. But he said, look, the only long-term solution is to get rid of I thought he called it a knuckle.
Yeah, well, I think he's a knucklehead, because there's a whole lot more that you need to do before you go through the surgery because of a pain in the foot that's unidentified. You need to identify the pain in the foot. It could be anything from a plantar fasciitis. Dr. Browning in our office did a great class the other night on foot pain, foot and ankle pain. And what we see often is the muscles that support the foot aren't holding the way they're supposed to, that the arch is not supported properly. If you have an infection, that's something that has to be treated properly. But other than that, other than joint degeneration where the joint space is destroyed and you have to do something surgically, there's so many other things that can be done, and we do them all the time. We treat many different athletes over the years. And what I mean by that, we treat professional basketball players and baseball players and football players, and both from the professional leagues in Washington to the guys that are in college or in high school. So there's a whole lot more that can be done, but you have to find out why the foot is in pain. Is the arch breaking down? So give me more data.
The podiatrist never even discussed the possibility of an orthotic.
Well, then he's crazy, man. I mean, there's some things that need to be done. You can get so much. It sounds like he needs to make a car payment. I don't know. But you need to have it evaluated properly. You have to test the foot muscles. You have to look at. One of the things that we do with every new patient that comes in our office is we do a Gait Scan, meaning that we monitor their acceleration across this pad that registers in the computer, so we can see how the different aspects of the foot touch the ground as you're moving, as you're walking. And that shows us if the arches are down. Then we test the muscles, in the foot, and then we watch patients walk up and down the hallway, and we fix those things. The majority of foot problems, whether they're plantar fasciitis problems or they're tarsal tunnel problems, can be fixed.
Out at the bottom. In other words, it looks like the infection may have returned, but it bulges out, and I have to walk carefully so I don't put pressure on it.
If it's an infection, and if it's treated properly, you may need to, if you've taken antibiotics and that hasn't worked, and the infection's in the bone. Now, we're talking about different things. That's why I need to have more data from you. If it's in the bone, you may have to have surgical debridement of it, and it has to be packed with antibiotics. But you need to make sure that that's what you're dealing with and ruling out everything else. It's not a simple process, and you need to know. I'm not getting enough data from you, Bob, to really tell you, it's this or that or the other thing. But what I'm saying to you is another evaluation is definitely in order here. You need to get one more look at the situation. Bob, I appreciate your phone call. If we can be of help, as always, give me a call. We'll be more than happy to take a look at it, or see somebody near you that can give you another look, another opinion. 888-630-9625. That's 888-630-WMAL. I'd love to talk to you. We're talking about your caffeine addiction. Latest research demonstrates that when people don't get off their usual dose, they can suffer a whole lot of problems. When we're talking about caffeine, we're talking about coffee, we're talking about black teas, we're talking about chocolate and so forth, and they include everything from headache to fatigue, and you can't concentrate, and you might even feel like you have the flu or nausea and muscle pain. Those are withdrawal symptoms, and when you keep trying to stop. So that cup of coffee in the morning that makes you feel better, it's because it's an addictive process, and you need more and more and more and more of it as time goes on. We have to take a break, but when we come back, I'm going to tell you what you need to do, and you better not ignore it because you're going to stay hurting. Can't help that. It's just, just the deal, and, health is a do-it-yourself program, right? Well, I'm going to show you how you can do it yourself. We'll be right back. This is Dr. Tom Roselle. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio, 888-630-9625, 888-630-WMAL. We're here every Sunday at 12 noon, bringing you the most interesting and updated information on integrative and alternative health care. That's why I do what I do. My job is to educate you, to challenge you, to make you aware that you really have control, that you can do something different. If you don't like where you are right now, guess what? Take a look at the decisions you made over a period of many years. Coming up to the first part of the year, coming up to January, we make resolutions. Well, don't make it on January 1 when you don't feel good because you did everything stupid over Christmas and New Year's Eve. Start thinking about it now. What do you want for 2013? How do you want your health to be? How do you want to put it together? Begin to create this vision of you, what you look like, how you want to feel, the energy that you want to have, and then begin to chunk the steps that are going to be necessary to very specifically, very methodically, step by step, get you there over a period of time. See, the biggest problem that we have is most of us expect to change things overnight. We expect that we can solve all kinds of problems in a short time, but we fail to realize that if we stay the track, that miracles work over long periods of time. That's right, miracles. You can end up a year from now far greater. Take pictures of yourself, get some blood work done, weigh yourself, do measurements, and put those aside, and then embark upon a path that you're willing to say, enough is enough. I'm done. I'm not doing this anymore. I need to have me. I want the energy in my life so I can step up and enjoy every moment that I have instead of being tied to a drug, instead of being tied to whatever other directive that some medical physician has told you to take. It's not okay. You remember I said over time, don't even believe me, do your own research? Well, here's the deal. You need to do your own research. It's Christmas time, and Hanukkah ended last night. Go buy my book, Ageless Health, Health is a Do-It-Yourself Program. You are going to find a map, a step-by-step, how to get there. Go to RoselleCare.com or go to drtomroselle.com and go to the web store and check it out, and you can hear all kinds of past Dr. Tom Roselle programs, but more importantly, you can download some videos. All of those in-house continuing education programs that we have, they're there. They're there for you. So you can check it out. By the way, the Ageless Health, the TV special, you have the trailer. And coming up, by the way, those of you who missed it, January the 1st, it's going to air again on WIDA, so make sure you find out what date and time it is. You're just going to be amazed at what happens with 6 people who made a decision to change their lives and embrace the triad of health, structural, chemical, emotional, actually can do for your life. Talking about things that you need to do to get rid of the caffeine. Okay, pay attention. Take your paper out and get your pencil out, and here's the deal. So what do I advise my patients? So those of you who have lower metabolisms or lower metabolic rates to begin with, you may find it much more difficult to stop the problem. And also, you have to make sure that you rule out things like chronic fatigue problems and lupus problems and fibromyalgia and MS and candidiasis, and it goes on, and thyroid dysfunction. Those have to be treated very specifically because you're using the caffeine as an addiction to get through that. Switch to decaf or low caffeine as you start moving through the process and steadily reduce your intake over the 4 to 6 weeks, sometimes 4 to 8 week period, and drink tons and tons of water. You need to have at least half of your body weight in ounces on a day-to-day basis. Now you got to add more because of the caffeine that you're drinking. You have to make a goal. Stop completely after 6 to 8 weeks, and remember that, like all addictive substances, any kind of dose is going to, even small ones, are going to stimulate that dopamine receptor side. Not a good thing. Your withdrawal is going to be difficult. Add vitamin C, 3,000 to 5,000 units a day. Add a lot of water. Support the adrenal system. You need to understand that if you don't, the ravages that are going to take place in your body are over a period of time. But you know what? If you want to be bad occasionally, and I mean like once a month or so, you can do that. If you go away, to Europe, to France or Italy, and you want to have that cup of espresso, you can do that. But you can't do it every day or every week or, on a routine basis, because it's going to eat you, friends. It's going to eat you up, and I don't want that for you. I want your health at the highest and most optimal level that you can possibly get. That's why I give the data. That's why I'm here every Sunday, 12 noon. Tell your friends. And if you'd like to talk to me off there, RoselleCare.com. See you next week. This is Dr. Tom Roselle. Bye.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.